Hello, everyone. My name is Daniel Rivers. I am the Partnerships Director here at AM Opportunities. In my role, I work with medical schools all across the United States and globally, making sure that when students rotate through AM Opportunities, that all the curriculum requirements are met, any affiliation agreements, basically everything you need to get credit for your U.S. clinical experiences, and that applies to U.S. medical students as well as students from, I believe we've worked with more than 180 countries. So with that said, today is a special webinar. We have brought on a preceptor who is one of the programs that we offer. And if you're interested in this or other programs, you can contact us after the webinar. But really, this program is very special, and I work with medical schools directly to kind of organize groups and cohorts to attend programs like Dr. Kountz. So maybe you could first introduce yourself and tell us a little bit about the medical students and graduates that you've worked with.
Happy to. Good morning, everybody, at least for where I am, good morning. And Daniel, thanks to you and AMO for this opportunity to be part of this preceptorship today. So I'm David Kountz. I'm an internist at Hackensack Meridian Health, Jersey Shore University Medical Center. I spend most of my days here at the medical center in Neptune, New Jersey. We're about 40 miles from New York City, about 70 miles from Philadelphia, right on the beautiful Jersey Shore. I work in a 625-bed hospital that provides all advanced care to our community, with the exception of solid tumors and burn care. But pretty much anything else you can think of, from bone marrow transplants to a level 1 trauma center to an advanced neonatal ICU, is what we make available to our residents, of course, to our community and to medical students to learn state-of-the-art care. We have 19 graduate medical education programs, 10 residencies, and 9 fellowships, about 190 total trainees at our hospital. We work with several medical schools. Our system actually has its own medical school, but we work with a number of medical schools, and we're I would say an IMG-friendly, both hospital and state. We accept residents who are on a J1 visa. And we clearly recognize that international medical graduates are a very important part of our workforce. They are terrific to be part of our care teams. So that's another reason why it's a special opportunity to be on this call today. So why don't I stop there, Dan, and then we'll keep going in the direction you'd like to.
Yeah, I mean, your program is really quite amazing, and I know a lot of students have been interested, especially latter year students or recent graduates. There have been many changes over the last couple of years in terms of the U.S. residency match, and there's even talks that Step 2 CK will move to pass-fail at some point in the future. So that means it's kind of left to a little bit more holistic approach to deciding who are the top candidates on an application. You can't just go to Step 1 score anymore, or Step 2 CS score. And if Step 2 CK moves to pass fail, what does your program do to help set apart their applications, and what are you looking for, without really going to those scores as the number one go-to step?
Yeah, you're right. I mean, I think we have to put this back in context that today, less than 60% of non-US IMGs match their first time they apply in the US match program. So thinking about strategies and ways to be more competitive is crucial for success. And this includes being able to show US experience, and we'll talk about that more in a second, potentially the opportunity to have done research, a letter from a US-based physician, networking, really showing those programs that you're kind of connected and you have ways to stand out among thousands of other candidates. We're fortunate at our hospital to have a dedicated 11,000 square foot Center for Simulation and Experiential Learning, what we call a SIM Center. The SIM Center is in a large medical complex, medical building across a small walkway from our hospital. And we've developed in collaboration with AMO a 1 month, if you will, preparation for residency program, really directed towards international medical graduates. What you will do in this month period of time is really work with our physicians, our residents in our sim center. You'll gain experience with standardized patients, community members who play the roles of real patients. We train them with scripts so that you get a feel for, I'm going to say it, the US patient. How do they expect to be approached by a physician? Many people may not have had that experiences, and there are always regional or national differences. So that's very valuable. And when we have our debriefing sessions, we not only talk about how that approach with the patient went, but talk about that clinical situation and what the current approach to managing that problem is. We also have in our center a high fidelity mannequin. So you will learn to work both individually and in a team approach with emergency situations. You'll gain experience with procedures such as placing a central line or a Foley catheter on a mannequin, much better than practicing for the first time on a real patient, the way I did when I went through residency. And if you think about what that month-long experience will be and how it would be viewed by a US program director, it will be very positive. You will show a lot of initiative, you'll gain this experience. Also during this month, you'll meet with our residents, we'll do mock interviews, you'll meet with our program directors and get a real sense in different specialty areas what they're looking for a prospective resident. So we've really put this program together. We think it will be a terrific experience. We've done a lot of the pieces with other students from other schools, and we've been working almost for a year with AMO putting this program together. We're really excited to get it started later this year or in the early part of 2023.
You talked about connections and building your network. And I always bring this up every time I do a webinar, because you can talk about the benefits of different kinds of clinical experiences, but often the network part is left out. It's talked about in business or economics, networking. How can you build your network, by doing a clinical experience? What are you looking for? What type of students are you going to stay in touch with? Are you going to want to see them succeed? How can they prepare to arrive and fulfill those expectations?
Yeah, those are great questions. And I think the first piece of this, I would say, is wherever you are listening from as a student at a particular school of medicine, if it's all possible, connect with your medical school's alumni association and find out where graduates of your medical school are doing their training. The term out there has been IMG-friendly and not friendly hospitals and states in the US and things like that. And I do think there is some truth to that. So it's also very natural that someone will want to pay it forward. And if you can figure out or find out who from your medical school is at a particular hospital, reach out to them. I mean, you have to be proactive and a little bit more extroverted if you're kind of a quiet, introverted person. You've got to make that outreach and say, hey, I'm at so-and-so medical school. I'd like to come to the US for a rotation, or I'm considering residency. Can we have a conversation over the phone? Can we have a Zoom? And can you help support me? So the first thing I think is really connect through your own school of medicine or through those contacts. The second is to utilize some professional social media platform like LinkedIn, which is the professional platform. And I would be interested if I saw a student who's really involved in a community service project, or is doing research, or is involved in the program I just described at Hackensack Meridian Simulation Lab, and post and say, hey, I'm 3 weeks into this great program, learning all about the US medical system, can't wait to apply for residency. So put yourself in those situations where it's a positive message and we see you connected to something you're passionate about, whether it's a community service project, research, or in the case of this program, gaining more US experience. That certainly will help you rise above other candidates.
A lot of IMGs maybe want to come in person, but they have difficulties, or their school is very a lot of work right now, so they're planning to participate maybe in a year from now or 2 years from now. Is there anything they can do at home to prepare, to be better prepared for when they arrive at Hackensack and participate in this program? And does that experience also help them? Is that looked at, experience in their home country, let's say working at a community health center in Pakistan or something, to kind of build their experience before they arrive, to build their network in the U.S. and their experience in the U.S.?
The answer is absolutely, but I would also say do things that you are truly passionate about, and it's better to be involved in a smaller number of meaningful activities that show that you have maybe increased the level of leadership or responsibility than necessarily being involved in a lot of little activities. I think that I counsel our US medical students in our own school that if you had two somewhat equally qualified academically candidates, the one person who's been in lots of activities only for a couple of weeks, thinking that looks good on their resume, versus a student who shows a real meaningful participation in some project, and they went up in terms of leadership of that organization. That's really more impressive. So I would caution not to worry about trying to scattershot and do a whole lot of different activities. Find a couple that you're very passionate about. That's also practically where you're going to get a more meaningful letter of recommendation, and you'll have a more meaningful impact. And when we interview together, you'll be able to tell me why that experience was so powerful and how you're going to use it to incorporate into your career.
I give advice or do webinars for U.S. medical students as well as IMGs. This webinar is more geared towards IMGs. But the advice I give is generally the same. But that being said, in terms of, what specialty to go for, it's always kind of, what are you most passionate about? But there is also the realism of, for IMGs, low match rates in certain specialties. How should IMGs kind of balance that out? If they really want to go into neurosurgery, should they also have backup with general surgery or internal medicine or something along those lines? How much should they balance their passion for a particular subspecialty that they know has a low match rate versus the reality of what IMGs generally do match into?
Yeah, a great question, Dan. And I think every medical student, IMG or US, should have a backup plan. It's so unpredictable. You'll even interview at a program where you will leave that interview saying, I nailed that interview, or they loved me on Zoom and they said such positive things, and you won't match there. And similarly, a program will feel that candidate loved us, and that candidate doesn't match there. So it's still somewhat up in the air. And the other reality, as you said, is, look, internal medicine, family medicine are much more available. They have a much higher match rate in the US for IMGs. And if your passion is to be procedurally oriented and you really were thinking about surgery, think about, I could do internal medicine and then maybe I could pursue a fellowship that's very procedurally oriented. So I do spend my days with the technology in the laboratory, and I'll get a great deal of satisfaction from it. Even in family medicine, you can say, gee, that seems so far away from surgery. But if you have a much better chance as an IMG of matching in family medicine, and then if you go into maybe a more rural part of the United States to practice, where there are, by the way, 1 million practice opportunities, you can, you'll be the one doing the office procedures, really meeting the broad needs of that community. So I think if you step back and think, what do I love about, say, neurosurgery? I like working with my hands. I like the technology. Some of the other specialties, even though it doesn't seem as though it is this way at the beginning, is really something to consider. I can still, in the long term, really have that degree of satisfaction, but make sure I get into the system, get a residency, and then go from there.
Great answer. I'm actually going to use some of that language in future webinars. That's a perfect answer.
Sure.
And for all of you out there watching this recording and those of you live, it is something that you will grapple with as you move towards applying to residency in the U.S. Now, there is one question that came in from the United Kingdom. I'm from a medical school in London. I was
Mhm.
wondering if you, meaning the student, doesn't have a sub internship, is it still possible to match having just normal rotations? And what I can say about this is, you must have your letters of recommendation, you must have your US clinical experience, and we've already talked about kind of the network effect, building your network of preceptors and different healthcare professionals across the US, which you can do from the clinical experiences. But having a program like Hackensack's program that we offer through the platform really gives you a lot more than just a letter of recommendation. And really anything you're doing in the US shouldn't be for that letter. It should be for the experience and putting your heart into it. And naturally, that letter will come. I diverged a little bit. Maybe you can address the question more specifically.
Yeah. So let's think about why is a sub-internship so valuable to a program? Well, it shows that advanced level of independence. It's starting to show the ability of that student, whether they're an IMG or a US student, to think independently, to make decisions, to have a little bit more initiative, to show those things. So in the absence of sub-internship, I think it would take the kind of program we're talking about, where you are, kind of drilled and challenged every day in a monitored but kind of mildly stressful setting, to show that you can handle, a variety of patients and function that way, or have letters that really speak to an experience where you show that independence, where you showed what we would otherwise expect to see in a sub-internship. So is it possible? Yes, but it's really going to take some other unique experiences to kind of get to the same level of what we'd expect to see with a more traditional sub-internship.
And then sort of, in each country around the world, we just use the general term US clinical experiences because we have so many different kinds on our platform. And around the world, in Brazil, they're simply called study abroad clinical experiences. In the UK, there's different terms. How does this program compare versus the common known terms of hands-on rotations, observerships, and research?
So New Jersey is a pretty restrictive state with regard to formal sub-internships for non-US medical students. We actually have some state statutes that really unfortunately prohibit students, with the exception of a few grandfathered Caribbean or Mexican-based schools, from sub-internships. So I happen to work in a state where a lot of those hands-on experiences are not available. So we've come as close as we can with the program I've described. You're working with university professors, you're working every day with residents, you're working every day with program directors. You are working with patients who have the most common problems that we see in the US. You're working in a simulation center with high fidelity mannequins. We set aside time for students to get training in quality improvement and patient safety. We provide time and oversight of students doing modules around research, which is really important when you can add that onto your CV and show that you have completed basic research modules. That will also show not only initiative, but that you're ready for that part of residency, where increasingly there's an expectation that you'll be involved in some type of research. It might just be a case report, or it might be more than that. And you will have already taken the steps to be prepared to jump right into participating in research in your residency program. So the focus is definitely on gaining those clinical experiences in a simulated setting, getting feedback so you can get better. It's not just the simulation experiences. If you haven't had a lot of those patient experiences for whatever reason, a lot of us are still coming out of COVID, you'll get those patient experiences. You'll get that high fidelity experience, which you can also talk about in your application, in your personal statement, but also these other pieces such as patient safety and quality improvement. Imagine today if you're interviewing and a program director says, tell me about issues we face in US hospitals with regard to patient safety. You'll be in a position to answer that question. and you'll be able to talk about the role of simulation to improve patient care. So it's much more than just a simulation center. We put together elements that will make you a much stronger candidate.
It's truly amazing that this program exists. I hope all of you listening here, both live and the recording, understand, because it's not just New Jersey, it's also California and other states where it's extremely difficult, if not impossible due to state laws, to get hands-on rotations as an IMG. Not only that, there are limitations in other states. For example, graduates cannot do hands-on in some states unless they've already taken and passed USMLE Step 1. And generally, most graduates just come for observership. So that comes back to kind of the same question, which you've already answered, which is, a lot of our visitors or people that inquire, they say, I must have hands-on rotations, but they don't kind of qualify due to whatever level they're at. We've seen many of our past visitors match for residency in the US with doing virtual clinical experiences or doing programs like yours without the sort of hands-on rotation. You have anything to add to that? Because there's really a lot of doubt in a lot of IMGs that, I must have hands-on rotations at top hospitals in order to match for residency.
Yes, I'll trust it. Dan, I just sent you a link. Tell me if you can open it, and if so, it may be something we want to show on the screen. It's a really kind of interesting.
Oh, sorry, it says I need access.
Oh, I'm sorry about that. Let me see if I can. Hang on 1 second.
Or you can share your screen. You should be able to.
Can I do that?
Yeah.
Okay, hang on 1 second. Thank you, everybody. Share screen. Okay, so while we chat, I wanted everyone to just take a look at kind of our logo for the program. And I will get back to Mr. Rivers' question. And if you can make sure you can read it, prepare for residency at Hackensack Meridian, Jersey Shore University Medical Center Simulation Lab. And your students can now enhance their clinical skills and safe patient practice through our partnership with the Simulation Lab. And it's just as I described, and you see at the bottom a couple other elements that make this, I think, particularly if you're coming from, whether it's across the US or overseas. If you arrive in the New York City area or New Jersey, Newark Airport, you don't need a car. You can take public transportation down to our part of the state, and then it's a 2-mile Uber drive to our hospital. So you don't have to necessarily worry about renting a car. You would have to find some accommodations. We would help you with that, but you don't need a car. I mentioned research training. There's a program based in the US called CITI, C-I-T-I, Collaborative Institutional Training Initiative. And we would help set you up to get that research training. And you could add to your resume, I've completed CITI training, and that will definitely stand out among other candidates. And this flexible learning model where some days you'll be working with standardized patients, other days you'll be doing the simulation mannequins, other days you'll be meeting with a group of residents to say, what was your experience? What can you tell me? What are some lessons learned? Or you'll have a mock interview with one of our program directors. So it's very flexible, and every day will be a little bit different, and we think that'll keep it interesting for you. Now back to the question at hand with regard to experiences in the US. I think that there's no easy answer for me. When I review the application of an international medical graduate, certainly a great gold standard would be multiple weeks in a advanced teaching hospital with letters that can speak very specifically to the student presented this case, or the student discussed this issue, researched this issue in great depth. But as Mr. Rivers said, that's not possible for most people. Well, what about coming to the US and working in an office setting with a physician? Well, there may be some value to that. What I often see is that's a very, very short-term experience. It may just be 1 or 2 weeks. And therefore, it's hard to gauge how much the student really absorbed from that experience. It's better than nothing. And I realize it's really difficult to get these experiences. but it's a lower tier than having that hospital experience, right? And we also find a lot of times the connection is through maybe family, and I understand that, but this is where that networking is so important. Rather than work with a friend of your uncle, and again, thank him or her for making an experience available, use that networking that we've talked about to get into a more challenging environment, a more complex environment, because that's what you're going to find in most US residency environments. So the real focus is use your network to say, hey, I'm coming from XYZ, I'll be in the United States. Can I spend a month with you? And I know that's kind of asking a lot of somebody, but you need to try to get a real depth of experience in a more complex environment. That will help prepare you for what you can expect as a resident, and provide a program, a detailed letter, really speaking to your energy and your competence and your potential to be a successful resident.
Great answer. And, for all of you, many of you have been on the AMO platform. We have over 260 clinical experiences, and we used to offer 2-week, 3-week experiences, and we found that it just wasn't enough. You really need a minimum of 4 weeks with a preceptor where they can learn about you. You can ask questions, you can, kind of research, and they can see how you grow throughout the experience to really earn a good LOR. And there are some private practices where the preceptor has great academic and hospital affiliations, and those letters will carry weight. But it really depends on what specialty you're going to, what your medical school. So I just wanted to add that in. But we do encourage you all to find the experiences you need in the ways that you can find them. Many of you have connections through your medical school or groups like IFMSA or other exchange programs. With that said, I'd just like to kind of turn it back to you to talk a little bit about anything that they can do to prepare and what you would like to see when they arrive.
Well, I think the most important things have to do with energy and attitude. And in fact, I think this is sometimes missed by candidates, that residencies are really looking for positive outlooks. Obviously, people who are willing to put in the hours. Now, I want to talk about wellness too, but you want to work with somebody who sees the glass as half full, who's not dissuaded by, some obstacle. This is often why IMGs are really attractive, because we know that you've had a lot of challenges to come from your home country to the United States. You've overcome a lot of obstacles. You bring a resilience and maturity, and those are really positive attributes. So we're really looking for letters that speak to those types of attributes. We're looking, when we have this kind of Zoom interview, to hear about your passion, to kind of get a sense of that level of commitment. So that to me is a really, really big part of this. One of the big, I'm sure, international issues, and certainly in the United States, has to do with the topic of wellness. And it's a really troubling, unfortunately, that many residents and practicing physicians struggle during their careers with depression and anxiety. And the US system is really recognizing that. And therefore, we also really take seriously when we ask, what do you like to do in your free time? So we want to make sure you've developed hobbies, you've developed ways to decompress from a difficult day. And if you think coming to interview with us and saying, in my free time, I read the New England Journal of Medicine, that would not be what we're looking to hear. We're really looking to hear that you've developed interest outside of medicine that will allow you to, I'll use the expression, work hard and play hard, really work to focus on the care of our patients, but also that you have ways to kind of come back to a good balance, and that you're recharged and ready to go for the next day. So what we're really looking for is evidence of that attitude, but also evidence of being able to handle a difficult day, and that you really develop interest outside of the practice of medicine or studying medicine.
Question came in from the audience, again, a British student, wondering how long LORs are valid for. If you do the program through AM Opportunities, you are assigned a one-to-one success coach. That coach will be with you before, during, and after your program. We have past visitors from 5 years ago that contact us for an updated LOR. Correct me if I'm wrong, but it must be dated within the last 2 years, but the actual experience doesn't have to be within the last 2 years. You just need an updated letter with the updated date when you're ready to apply, upload to the ERAS system.
Yeah, absolutely. It would be better if the experience is contemporary, but I think that point is valid, and we would be willing to accept a letter that's dated within the last 2 years. It stands to reason that further you're away from a clinical experience, you may not be as up to date with protocols, or as perhaps as effective as if you had had the experience within the past year. But to answer the question, a letter dated within the last 2 years is fine.
I believe you can upload up to 4 letters of recommendation. I just had a friend match for residency in plastic surgery at the Mayo Clinic in New York City, and all of his experiences were kind of 3 to 5 years before, but he, at least from the letters, he got updated letters, but he did 1 or 2 months right before he applied, so that he had some recent experience. Just like the doctor said, you want to have some experience in the year leading up to when you apply, so that it's contemporary and relevant.
Right.
I've asked all the questions I kind of prepared. I see some other questions that came in that I can address more around nursing, but anything else you want to maybe share your screen and show some slides, or anything?
Yeah, let me
final
do
advice
that.
you'd like to give? Sure.
Absolutely. Let me pull up my screen and just see if I'm not going to show every slide, but there are probably a few that I'd like to maybe highlight for the group. So everybody just give me a second to find the presentation, which of course I probably pulled down. So let me just find it for a second. Okay. And let me whoops, sorry.
There, perfect.
So thank you. So we talked about the match rate. That's why discussions like this are so important. It really is. It would be, we need you all who are part of the AMO family. I think just by focusing on some of this advice and the opportunities AMO makes available, you'll have a much, much higher rate of success. And that's what our goal is here. I talked about my network, and I talked about my hospital, which on this slide is Jersey Shore. But across our whole health network, we have over 800 positions in over 60 programs. So we are a large GME enterprise in the state of New Jersey. We're the largest in the densest state in the United States, and we have lots of training opportunities from northern New Jersey, very close to New York City, to the Jersey Shore, to the middle of our state. We really value, as I said, the impact that international medical graduates have in our state. More than 50% of any resident, if you were just to survey our residency programs in our state today, are international medical graduates. 38% of our practicing physicians in our state are international medical graduates. So when we come back to that concept of networking, there's probably no better state or region of New York and New Jersey to think, gee, there are a lot of international medical graduates. I heard from that guy on that webinar. There's got to be someone from my school who's practicing there. Let me figure out how to find him or her and reach out to them. Oops. We haven't talked about COVID and the impact of COVID's had on this whole process. It's obviously limited in-person interviewing. So at our network, we're only doing virtual residency interviews. Pretty much all of the professional societies have recommended that this year. We are going to allow second look visits, but only after we submit our match list, because we don't want to disadvantage some students versus others. So later in the application process, we will be inviting our top candidates to come on a limited basis. We still are in COVID restrictions, so we can't allow 50 people to come at the hospital in one day. But as we get into January and February, we will be offering second look visits to our top candidates. We've already talked about this step one transition. Talk more about that in a second. COVID-19, something I've already talked about, the increased focus on wellness and resiliency. Some residencies have become more popular as there's been increasing focus on the importance of mental health and behavioral health. So we've seen increased match fill rates in psychiatry. But because of the development of telemedicine in the United States as a result of the pandemic, and many people still having anxiety of going to emergency rooms and more availability of telemedicine, there have been more openings in emergency medicine. And we've somewhat started to discourage our internal School of Medicine students. We want them to be aware of that and maybe not be so high on emergency medicine. For the first time, we're seeing emergency medicine graduates not being able to find a job. We have a big focus on addressing diversity. So if there's another topic area that would help an international graduate kind of think about what a program might be asking about, or would say, oh, that person's really done some reading. We have realized, especially because of COVID, that having diverse providers, diversity in terms of race, ethnicity, is important because of the disparity or differences in how COVID has impacted certain populations. So it'd be worth, before an interview, doing a Google search to read more about this, because if I were a program director, I might ask you, so what do you think about the importance of diversity in a residency program or among our providers? Residency programs in the United States have continued to increase. That's a good thing. It provides more opportunities for our candidates. They increased about 3% from 2021 to 2022. As I mentioned, there have been some changes, a reduction, frankly, in emergency medicine match rates or fill rates, but an improvement in psychiatry. And that's shown here, that for the first time, and see what I'm pointing to here, we had 69 emergency medicine programs unfilled. And this is just supply and demand. And I think US students especially were becoming keen to this. And psychiatry has continued to go up. Many communities have been impacted by COVID, by the mental health impacts of the pandemic. And this is, I think, led more students to consider psychiatry because that's becoming more competitive. Step one score, let's face it, really important. You've got to pass step one, even if it's pass-fail, you pretty much have to pass it. This letter of recommendation, what we were talking about during the webinar, having that high quality letter of recommendation that can speak to your current performance and future potential. Step two CK score will definitely be moving up in importance as step one goes pass-fail. Personal statement, dean's letter, etc. So the things I think you would expect to be most important to a program are listed here. Step two will become more important because of step one going pass-fail. Letters of recommendations will be more important. Programs like what we've described, our simulation lab, gaining that US experience, this holistic idea is something that can be added into a letter, say from a system like ours. If you've spent a month and we can speak to your enthusiasm, your competence in our simulation lab, those things may not have been as important 2 or 3 years ago if a step one score was there. Now you need to look for these unique experiences. I know that, we shouldn't focus a lot on what my step two CK score should be. My experience is, it really needs to be in that 240 range, that these programs our programs becoming more and more competitive. And for you to be a top quartile student, you really need to be in the 235 to 240 range, almost regardless of what you're going to be applying for. So we talked about network. We talked about knowing things about that hospital to be a better interviewer. Even if you can, find out who's going to interview you and look them up. So I can say to Dr. Kountz, I know that you've had an interest in research in hypertension. I'd really be impressed that you took the time to look that up if I'm your interviewer. And sometimes coded language, we won't spend a lot of time with that, but for the young ladies, the women on the call, sometimes terms that we tend to use in common conversation don't convey the degree of seriousness for them to be viewed as a top candidate. So we're educating our interviewers when they write a summary of our candidates to make sure that the language is gender neutral and not to rely on terminology such as she's lovely or he's pleasant when other students are described as scientific, determined, or knowledgeable. It's hard for you to impact this when you ask someone to write you a letter, but if you have that type of relationship, maybe you can just remind them to really use that powerful language that will really benefit you. We've already talked about networking. And here's just an example. I just did a screenshot of 2 medical students. One is interested in pathology, and she talks about a case study here at the bottom, just kind of neat. And here's another student who talks about her interest in medical translation, skills in management, passionate about community and social services. So if I have 2 equally qualified candidates and she sends me in her bio a link, I'll do a quick look and say, oh, she's out there in the community. She's expressing an interest in community service. She's bilingual. Who am I going to interview first if this individual and someone else is applying to our program? So I won't double down on this, but we talked about the importance of U.S. experience if at all possible. The U.S. is a different environment, so getting U.S. experience in a letter from a U.S. physician is obviously very important. So we don't need to keep reviewing that point. We haven't talked about the personal statement, and I want to make sure I'm not doing okay. We're good on timing. So you have a chance to really tell us about yourself, obviously, when you write the personal statement. And I do think, as you see in that cartoon on the left, it is important. There's no perfect candidate. So if something has happened during medical school, this is your time to tell us how you have rebounded from that situation and how you're going to improve going forward. And remember, when your application goes to a committee, and let's say there was a withdrawal or a failure somewhere, none of us is perfect. But if you didn't take the time to explain it, either during your interview or in your personal statement, we're left as a committee not knowing what to say about it. And you might think, well, my interview didn't ask me about it, so I didn't need to write about it, and great news, the interviewer missed it. But when we sit in the committee and we're drilling through, a pretty detailed look of your entire application, we'll find it. And we'd rather have someone say, oh yes, he explained it, or I interviewed her and she talked about it, than to leave it to chance. We want to hear about your motivation. And that fourth line is important. I at least like to see, beyond you talking about yourself and what you want to do, what are the issues that we're dealing with in our country, and how is our training you? How are you going to contribute to improving the health of our community, the health of our society? Are you aware of the issues around quality of care, patient safety, the importance of diversity? How are you going to contribute to those mission areas? And of course, it has to be perfect, right? So you need someone who's not a close friend, someone to really critique it. Grammatical mistakes, sentence structure, all those things are really important. What derails candidates? You think you sent in a great application, you think you're in a great place. So application issues, time gaps. We need to know at every point on your application or your resume where you were, even if it came to the US for 9 months, studied for step 1. That's fine. But if you leave a gap that is otherwise not explained, that's a real no-no. We talked about the personal statement already. Letter of recommendation issues sometimes can derail a candidate. Too little US clinical experience and applying too late in the application cycle. So just like applying to medical school, applying to residency, programs tend to have more energy, more passion, look more critically early on. And what can happen is after they've interviewed, several hundred people or screen several hundred people, they may just shut off the process. You might be a great candidate, but if you submit your application late, the program just won't consider you because they've already made decisions on interviewing this group of applicants. So really understanding timelines and getting your application in as soon as the application portals for residency programs open. We've talked about innovative experiences. I've talked about our Sim Center. If you speak more than one language, it's a real value to many of our communities. You know, take courses from the Institute for Healthcare Improvement. Boy, that would impress me if I said, do you know anything about patient safety? And you said, yes, you know, I spent time taking the free classes from the Institute for Healthcare Improvement. And if there is a patient quality issue here in the hospital, I will know how to help figure out what's going on and make recommendations on how to improve it. That would make you stand out. And we've already talked about what's called city training to prepare you to participate day one in research. We've already talked about our Sim Center. So Dan, that's a quick review of what we talked about. Maybe a couple of new ideas came out, but yeah, maybe there'll be a few questions as we wrap up in the next few minutes.
No, for all of you here, and there was about 180 people that registered, so all of you will get the recording of this this event, and we will also be sending this recording out to lots of other IMGs across the world. Such great information, and we know you're busy, so we really appreciate your time. Very detailed. We always talk about those gaps, and people worry about those gaps, but as you heard here, studying for USMLE is not a gap. You just have to explain that's what you were doing at this time. So keep that in mind, because we do know not all countries have medical schools that allow you to take time to do US clinical experiences. There are some countries we work with where you know, you're busy from year 1 through year 6. And most of the time, those students are coming to programs like Hackensack and other programs on our platform after they graduate. So, you know, the earlier the better. I guess my last question is around that, because I always say start early, right? You know, the biggest thing I hear when I talk to people who just matched is, I wish I had started earlier, because the later they start, if they wait until after they graduate, they're kind of trying to get all the requirements met. You know, what's the earliest someone could maybe participate in your program?
So we really don't have any limitations. We would accept, assuming, and we're not in a position to give credit for the home medical school. It's very important to state that. But we would very likely accept a first-year student if he or she had the time in their schedule. It might motivate them. It might give them a different perspective. I do think from a practical standpoint, as you are moving through your medical school and you're getting closer to residency, just like a shadowing experience, if it's fresh, if it's something you've done, and then 6 months later, you are in the application process, you have letters from us, that will really impact the program likely more significantly than if you had done it 3 or 4 years before you apply. So I think from a practical standpoint, gaining the basic science knowledge, thinking, gee, I want to get US experience. When you're thinking US experience, this would be the type of program to put in your mindset as, if I can get to a hospital, if I can get to a doctor's office for a month, this will be a comparable option at that stage in your career.
And you do need to plan. Programs are expensive. You may need flights, housing, visa. You know, depending if you're a US medical student, you need to arrange the time. Abroad, again, you need visa, flights. So plan it out. You can always speak with our advisors. We can talk you through the program at Hackensack and let you know, what are the next steps depending on where you're coming from. Thank you so much, Dr. Kountz. Really appreciate your time. Very thorough. And I can't wait to share this information with more of our visitors.
Wonderful. Thanks, everybody. Bye-bye now.
Thanks so much. Bye-bye.